Folks, it's something that you may not want to talk about, but it is something that is very important that we do need to talk about. And of course, we are talking about a disorder that can affect the regular workings of the body. We've got some more information for you, so check it out right here.
So a lot of people don't know what a urogynecologist is. A urogynecologist is someone that either did their training initially as a obstetrician and gynecologist and then did a fellowship in urogynecology, or was originally trained as a urologist and then did a fellowship in urogynecology. And we take care of women that have pelvic floor disorders. Pelvic floor disorders are a variety of disorders that affect women. This could include things like urinary incontinence, or trouble even controlling bowel movements, or something called pelvic organ prolapse. Urinary incontinence is a fancy word for leaking of urine. And there's several different types that women can have. The two most common types is something called stress urinary incontinence. And what that is when women leak urine when they're doing activities. So things like coughing, sneezing, laughing, exercising. Something that brings in a lot of patients to see us is when they're jumping on the trampoline with their children and they're having trouble controlling their bladder. The other main type of leaking that women have is something that falls under a category called overactive bladder. And that can be a variety of symptoms that could be, I feel like I have to go to the bathroom all the time, I get up at night all the time to go to the bathroom, or I get a very strong urge to go. So that's that gotta go feeling. You rush to the bathroom and sometimes you leak before you get there. This can affect women from all age groups. It can affect young women that might have just had a baby and are struggling with some of these problems, and it can affect women in middle ages and all the way into our elderly population. So it really is a problem that can affect all women from all walks of life. Something that I would really like to stress is how common this problem is, but women are so embarrassed about it. They think they're the only ones that have it. It's a secret that they hide, and they don't know who to talk to about it. And a lot of women actually stop doing things that they enjoy. They might stop playing with their children. They limit their social interactions because this is such an embarrassing, hard thing for them to deal with. And the important message that I'd like women to know is that there is a lot that we can do for it. There can be non-surgical options and surgical options. What we hear a lot of our patients say is that once they've discovered us, or they've come to see someone that takes care of this, and they've started talking with their family or friends, they discover that this is something that a lot of people have that they know. I think the hardest step is knowing where to go to get help. So myself and my partners work at the University of New Mexico, where we have all these services available. We also work at Sandoval Regional Medical Center, which is a UNM facility that's located in Rio Rancho that also has this whole variety of services available to them as well.